For more than 3 decades, the Wolfheze movement has brought together experts, policymakers, and communities. To honor its legacy and look forward to the future, we invited distinguished colleagues to share their memories, reflections, and advice.
What did Wolfheze means to you personally and professionally?
The Wolfheze workshops provided me personally is the opportunity to learn from the experiences of colleagues in a very friendly atmosphere and to use these experiences in my day-to-day work. Not only experiences about what went well, but especially about what went wrong. It is this comfortable partnership that brings our work to a higher level. I am glad to have contributed to this process from the very beginning.
Good afternoon to everyone. I'm Professor GB Migliori, and I want to share this experience with the question one, which is what Wolfheze represented in my personal or professional life. So I had the chance to participate to all the first series of the Wolfheze meetings since the first. And in the first was a think tank for experts, which included also experts from US, Canada, and Japan. So some 40 experts plus 2 young persons who were there like students to become future experts, something like that. And then I had the chance to be chosen for this together with Akiro Seita from Japan, who then was the regional TB advisor for EMRO, WHO EMRO for many, many years, a great friend. And then we initiated our career there. So it was so important for us, this event.
There is no doubt in my mind when I state that the Wolfheze movement was certainly one of the most remarkable experiences of my personal and professional life when I was working at the World Health Organization on tuberculosis, especially during the first decade of the 1990s. That rural environment of the Netherlands, especially during the very first few meetings, was a conducive environment where people could socialize, they could discuss the whole day long, right? In informal sessions outside, during breaks, during lunch, during dinner. Fantastic experience with all the European countries and the major organizations working on TB, all there to discuss and debate what needed to be done at the time in Europe.
To me, Wolfheze is the human face of the TB community in Europe. I became acquainted with its work in the early 2000s, when I was starting to work on tuberculosis and more or less halfway into my career in public health. It taught me the value of professional bodies in setting up a strong and sustained and functional movement in reaction to a public health threat. It also impressed upon me the value of achieving consensus and of documenting common positions.
From 2006 to 2020, I was part of the Wolfheze family. At least that's how it felt for me. Wolfheze meant to me intense discussions, pleasant conversations, and productive collaborations with colleagues all over Europe on what was driving us all, fighting and preventing TB. It gave me focus on the priorities in my work at KNCV Tuberculosis Foundation.
Good afternoon, everybody. I need to say that I have very warm personal and professional memories about Wolfheze workshops. I remember very well my first participation at the Wolfheze workshop in 1996, being a young WHO staff. But from 2000, when I started my activities as a WHO regional advisor on TB control in the European region, I and my colleagues were very closely involved in the organizing and conducting Wolfheze workshops. And now I am confident that this was a unique and significant movement in the fight against TB, not only at the European level, but at the global scale also. And for me, Wolfheze workshop provided a good opportunity to work closely with colleagues from different entities such as KNCV, ECDC and others, make new friends, and to strengthen my professional knowledge in the fight against TB and healthcare in general. Thank you.
For me, the Wolfheze movement has been much more than a professional network. It has been a community of people deeply committed to end tuberculosis in Europe and beyond. Being part of Wolfheze has reminded me that behind every guidelines or every consensus statement or policy document we've been working on, there are real people whose lives can change through our collective efforts.
Rebirth of the Wolfheze movement. Congratulations. My first meeting with the Wolfheze movement was, I think, more than 2 decades ago. I went from Denmark to the Netherlands, and then I took a train to the middle of nowhere to a small village called Wolfheze. And then even arriving at this train platform in the middle of nowhere, I had to walk for Hotel Bundenkamp in the middle of the forest. And when I arrived in the forest, I met a lot of interesting tuberculosis expert for the first time, and I felt very humble and privileged to meet these person as a very young scientist at that time. I remember Jacques Veen, who was the extremely friendly host. I remember Hans Rieder, an icon, epidemiologist icon that I really love to talk to, also Kitty Lambrix. I also remember the 2 interpreters that translated between Russian and English, and I was there because I was a specialist in genotyping with a restricted Frank length polymorphism method. That was before whole genome sequencing, and I really gave them a hard time discussing transmission dynamics between nationalities based on Danish data, mentioning clusters, insertion, elements, transmission dynamics, and they had to translate that into Russian. They had a hard time. It was such a privilege to be part of this group discussing TB control and science, and also I think you felt that you were part of a family, a movement that did do something different from tuberculosis. I'm sure the Wolfheze have made a significant contribution to TB control over the years, and maybe that can happen again, because we still see TB among socially disadvantaged groups today. We've seen increase in death and incident during the COVID pandemic, and we are recovering now in Europe from that. There's still a need of more focus on how do we get from knowledge about risk groups, treatment, to action. So I want to see some more action. How do we actually address the problem in a way so we see fewer cases in the future? There's so many bad things happening in the world at the moment, so it's very easy to get distracted from the attention on tuberculosis. Maybe we're the one who need to insist on these vulnerable groups, get the medicine that's there, get the diagnostics that's there, so we can move in a better direction in the interest of the TB patients and the society. Happy Rebirth.
For me, Wolfheze is not just a professional platform, but a community of like-minded individuals who inspire change. On a personal level, I have always valued their openness, partnership, and depth of discussions that have shaped my vision of the fight against tuberculosis. Professionally, it has been a place where ideas were born, ideas that truly influenced policies, practices, and the lives of patients. Wolfheze is a space where science, experience, and humanity come together in a pursuit of a common goal.
For me, the Wolfheze movement has always been something very special. It's not just a professional network, it's a true community of shared values and friendship. Wolfheze gave us a platform where clinicians, researchers, and policymakers could speak with one voice, united by a common mission to end tuberculosis in our region, Professionally, it shaped the way we think about TB control in Georgia and beyond, not as an isolated medical issue, but as a collective responsibility that requires solidarity, science, and compassion. The Wolfheze spirit reminds us that real progress happens when we listen, learn, and work side by side for the health and dignity of every person.
Здравствуйте, меня зовут Валентина, и для меня участие в движении Wolfheze всегда было чем-то особенным. Wolfheze — это не просто конференция или собрание специалистов. Это место, где встречаются люди, которые по-настоящему верят в общую цель остановить туберкулез. Мне всегда нравилась открытая атмосфера, когда можно говорить искренне, когда можно делиться своими проблемами, учиться у других и при этом делиться опытом своей страны. И, наверное, самое ценное — это то, что за всеми стратегиями и показателями мы не забываем о людях, затронутых туберкулезом. Мы не забываем о человечности нашей работы. Wolfheze помогло мне профессионально расти, но еще больше верить в силу сотрудничества. Я очень благодарна этому движению и тем людям, которые его создают.
Hello. I attended my first Wolfheze conference in 2001, which took place in a forest hotel near the village Wolfheze in the Netherlands. I was intrigued by the open discussions among health professionals from so many different countries and backgrounds. The translators did an excellent job making sure that everyone could follow the discussions. Back then, I would describe Wolfheze as East meets West and West meets East. It created a unique space where NTP managers, researchers, NGOs, and international organizations could share experiences, build strong professional relationships, and create friendship. Over the years, Wolfheze has been an inspiring platform to me, a place to learn from each other and to grow professionally. I also had the opportunity to organize the conference a few times on behalf of KNCV together with ECDC and WHO Europe. Those experiences helped me develop new skills, which greatly contributed to my professional career, for which I'd like to thank you all, and I wish you a very good conference.
What do you think was Wolfheze's greatest contribution to NTB in Europe?
The Wolfheze workshops were an initiative to collaborate across borders of countries that shared a similar, low epidemic, but developed due to a changing political climate, into a collaboration of countries that shared a common geography, leading to a declining epidemic in all countries that participated not only from a clinical perspective, but especially using all contributing interventions in tuberculosis control. Some of them were unheard of at the time I left.
The Wolfheze movement's greatest contribution has been its ability to translate scientific evidence into coordinated action. It created a bridge between national programs, experts, and international partners, turning ideas into policies that have saved countless lives. Through Wolfheze, we established common standards, strengthened surveillance systems, and built a culture of mutual learning across Europe. It also gave smaller countries like Georgia a strong voice in shaping regional TB policy. The true power of Wolfheze lies in its ability to connect people, and that spirit of partnership remains its greatest achievement.
What I think was particularly successful in the Wolfheze workshops or the Wolfheze movements or whatever you call it is the way how we worked together to find, to choose relevant topics, to find people to explore them, and to engage with NTP managers through surveys to understand country approaches, needs, and challenges. Bring all that information together in a working group with people with different backgrounds and from different countries, created a good mix of ideas. And over the years, this process has led to many important guidance and consensus documents. But equally important was how these documents were developed, and that is through open, constructive discussion at the Wolfheze conference. I also like to share something that stayed with me, and that is the power of words. Some of you might remember the Dutch patient who spoke at the conference about her experience after being diagnosed with smear-positive TB. After hearing the diagnosis, she cycled home with her child in front of her to what she called my own domestic sanatorium. And these 4 little words very clearly explain the need for a person-centered approach. The words I hope they still echo in your mind as they do in mine, and I hope that they're now echoing in other people's mind.
One of the most significant contributions of Wolfheze has been the creation of a solid network of committed people with public health at heart, beyond Western Europe, where the movement originated, and into the central and eastern parts of the continent, where most of the European burden is concentrated. Wolfheze catalyzed the development of a harmonized method for tuberculosis surveillance. This tradition of defining things clearly has persisted since then and helps us speak the same language.
The greatest contribution of Wolfheze has been the creation of a unique platform that brought together national programs, civil society, researchers, donors, and patients around a shared goal. This collaboration has fostered the implementation of people-centered approaches, strengthened health system, and shaped evidence-based policies across the European region. Wolfheze is a space where challenges can be openly discussed, experiences exchanged, and joint solutions found. It is a true catalyst for change.
Dear colleagues, the Wolfheze movement has played a tremendous role in strengthening TB control and surveillance in Europe. I think the greatest contribution of the Wolfheze workshops is, first of all, the gradual development of strategies for TB control in low, medium, and higher incidence countries, looking for the whole Europe despite the epidemiological differences in the West and the East. This includes the implementation of a uniform case definitions, DOTS implementation, and drug-resistant TB control in the higher incidence countries, as well as a strategy for the TB control in migrants. I would like to emphasize especially human resource development, because each Wolfheze workshops was in reality excellent training course for its participants, but workshops materials for national program managers. Thank you.
It's hard to say what was the greatest contribution of Wolfheze movement. Was it the strengthening of the ties between the stakeholders in the TB network, or the exchange of country experiences showing what worked and did not work? For me personally, it was the collaborative effort to publish a consensus document on evidence-based contact investigation that culminated in a consensus paper in the which was published in European Respiratory Journal in 2010. I believe it's boosted the TB prevention throughout the region and perhaps also wider in the world.
Wolfheze has been an incubator for many ideas and initiatives. One of the best examples I can mention is the minimum package of cross-border TB control and care, which has been a consensus statement developed through close collaboration and consultation with the national programs, people affected by TB, NGOs, but also key stakeholders at national and international level. This consensus statement has paved the way for changes in policies and practices across our region, and also has been used as a model for other WHO regions.
The contributions of the Wolfheze movement to TB care and control in Europe, for me, are invaluable. There is no other movement I can think of in the history of tuberculosis that I know that had the same efficiency as that movement. We have to think and consider that in the early 1990s, there was no standard in tuberculosis care, control, in the way we were doing surveillance, in the way we were defining cases, monitoring the treatment outcomes, and so on. Wolfheze was exactly that. It was putting together, gathering of all European countries, West and later East, to define common strategies for care and control of TB, and even research at a certain point in the European context. And I can just name a number of documents, consensus documents with all countries signing off, with the Union, WHO, and KNCV signing off, which would then literally set the standards for surveillance, for treatment outcome monitor, for drug-resistant surveillance, common understanding of what needed to be done for TB elimination. So no doubt in my mind also in this case that Wolfheze was crucial.
Когда я думаю о вкладе Wolfheze, первое, что приходит на ум, это сила сотрудничества. Wolfheze создала пространство, где все страны, специалисты, организации могли говорить на равных. Здесь ценился не статус, а именно опыт и готовность делиться этим опытом. Благодаря этому появилась настоящая культура партнерства между клиницистами, эпидемиологами, менеджерами, представителями сообществ. Многие решения, которые сегодня считаются стандартом, зародилось именно здесь, в открытых обсуждениях и в совместных поисках ответов. Думаю, именно это и есть главный вклад в Wolfheze – объединение людей и идей ради одной цели – сделать Европу свободной от туберкулеза.
I think in a time where we didn't have yet proper definitions, we didn't have the collection of treatment outcomes yet in Europe. Surveillance was just notification of cases and not particularly brilliant. Wolfheze had the enormous merit through its initial documents to set up the scene for TB elimination first. This was the first document from Wolfheze. And then setting the definitions, the minimum set of variables for surveillance, the treatment outcomes, plus an important document on migrants. Those were the first documents I was part of in writing, and we all published in the European Respiratory Journal. I started then serving as associate editor. And I think this was the beginning of a European track towards standardization, and then finally a development of a coordination between WHO and the new ECDC that at the time did not exist. Very important, therefore.
How should the Wolfheze movement adapt to meet today's challenges and opportunities?
I believe Wolfheze movement needs to adapt and evolve. There are three elements that I consider priority. One is digitalization. There should be a platform where the national programs, communities, people affected by TB can interact and build consensus. Second is artificial intelligence. We need to embrace artificial intelligence and get artificial intelligence supporting the TB prevention and care in the region through the Wolfheze. And third important element is integration with other diseases or conditions, for example, HIV, hepatitis, or any other diseases or conditions which can benefit from this platform, and their integration or inclusion can benefit ending TB as early as possible in our region and beyond.
I think a fact is that it's difficult to organize events like Wolfheze in person for lack of funding, but also organizing this online as a 1, 2, or more days online proved to be difficult. So I would try to do something more agile and maybe online with what WHO made with the WHO Euro TB Consiglio. So a series of webinars that under the coordination of a team of coordinators might propose different topics, and in the line of these webinars, eventually some other strategic documents can be designed and proposed in case. Something like that, very, very simple, very easy and cheap to organize, open to everyone, and dynamic in the way it's done. A great day to everyone.
Although a significant progress in TB control has been made in recent years, owing also to Wolfheze movement, what has been achieved so far is not sufficient, because TB and MDR-TB is still a significant problem in Europe and globally. During recent time, we have faced with new challenges in TB control, for instance, COVID-19 pandemic. International migration become now an urgent issue. taking into account the current geopolitical situation. That's why the rebirth of Wolfheze movement, I think, is vital. Because of limited time, I will mention from my point of view the most important challenges that Wolfheze workshop should address. First of all, TB care and prevention among migrants and refugees, strengthening of TB prevention, diagnostics and treatment within primary health care and health system in general, strengthening TB surveillance system and laboratory network. It should be mentioned also further close collaboration with HIV, hepatitis, and other TB-related services. Thank you.
The future of Wolfheze lies in transformation, digital, inclusive, and action-oriented. It must become a space where science meets a human-centered approach and lived experience intersects with political influence. Wolfheze should remain a platform for shaping strategic decisions that respond to the challenges of our time, from antimicrobial resistance and rising social vulnerability to the consequences of pandemics, wars, migration, and climate change. Wolfheze must bring together experts, communities, policymakers, social workers, psychologists, educators, thought leaders, and patients. Only through such collaboration we can create solutions that work in the real world. Together we can set shared priorities, pool resources for joint initiatives, and launch collaborative research projects. Wolfheze must adopt while preserving its unique strengths, the ability to unite people, ideas, and experience.
Yeah, I believe Wolfheze should continue to provide a formal and informal network for exchange in the European region. Challenges, evidence-based policies and solutions, and ensuring strong ties and collaboration between TB professionals, TB advocates, and other stakeholders.
Сегодня Wolfheze стоит на новом этапе своей истории. Мир меняется очень быстро, и это создает и вызовы, и возможности. Мне кажется, что самое важное – это сохранить ту человечность, которая всегда была в основе движения, но при этом открыться новому. Использовать цифровые инструменты, привлекать молодых специалистов, активнее работать с сообществами пациентов. Wolfheze всегда был местом обмена идеями, и теперь оно может стать еще и пространством инноваций. Если мы сможем объединить опыт, ценности и новые технологии, движение останется живым и сильным. И именно таким, каким оно всегда было. Местом, где создается будущее борьбы с туберкулезом.
Dear friends, today Wolfheze faces a new chapter with new challenges, but also with new opportunities. To stay strong, the movement must continue to evolve. We need to embrace innovation, digital health, and new ways of reaching people with care. We must build on our strong foundations, but also embrace new ideas from digital health and innovation to community engagement and patient-centered care. The movement should continue to bring people together, not only experts and policymakers, but also those affected by TB, whose voices are essential. Wolfheze must remain a living, dynamic platform, open, inclusive, and forward-looking. If we stay true to our values of collaboration and compassion, the Wolfheze movement will continue to lead the way toward a future where TB is no longer a threat to anyone, anywhere.
I start from the consideration that Wolfheze can provide the correct environment, the socially friendly environment where tough discussions can be conducted, can be held. And if we think about the challenges that TB control and care and research are facing nowadays, there are many of them. I think that an environment like Wolfheze would be ideal. That's why I would resume the Wolfheze movement, where I convene countries, where I have the major agency also part of the discussion. And if you ask me what are the big themes, well, there are many. I mean, and I just think about the AI and the importance of artificial intelligence nowadays in control of disease. I would also think that the environment in Wolfheze is ideal to start a serious discussion about the revisiting of the NTB strategy. The NTB strategy dates back to 2012 when we started conceiving it, and it was approved in 2014. So we are talking full 10 years, 12 years ago. We need really to look into that again. We need to look at what I consider and I call the fourth pillar, that is the contribution beyond national programs, beyond even health, the contributions to TB, to the TB burden and potential solutions by other sectors. And I think that this kind of strategic discussions can be easily held in an environment like that of Wolfheze, outside of officiality, in the middle of rural Netherlands. And I think it would be ideal.